Hello, this is Bill A. Williams, Medicare Health Insurance Options. In this video, we're going to talk a little bit about comparing the different type of health insurance options that are available to people who do reach Medicare age. One of those is Medicare Supplement. The other is Medicare Advantage. And we're going to explain and discuss how each of these works. The first thing that I want to mention is whether you choose to get a Medicare Supplement or a Medicare Advantage plan, you still must, in either case, have Part A and Part B of Medicare. Therefore, you do continue to pay your monthly premium for Medicare Part B in either case. We're going to start with Medicare Supplement. This is really the easiest to explain. On a Medicare Supplement policy, Medicare Part A and Part B is your primary, your main coverage. Then you have the option to enroll in a private secondary policy. This is sometimes called a Medigap plan, also more commonly referred to as Medicare Supplement. There are a few different Medicare Supplement plans to choose from. Right now, most of our customers either are going with a Plan G or a Plan N. We can discuss with you the reasons why you may choose one or the other and give you some pricing for each. The way a Medicare Supplement plan works is fairly easy. First of all, you have a very broad selection of providers. You can go to any medical provider in the United States that accepts Medicare. Medicare pays first. Your Medicare Supplement pays second. This also allows you to have very good predictability in the sense that you know what your maximum out-of-pocket is going to be for all of your doctor hospital bills. You simply add up your monthly premium and then add in any deductibles that you might have. That will be your maximum out-of-pocket. The other option, which is a little bit more complicated, is called Medicare Advantage. These are network policies. First of all, I want to explain how a Medicare Advantage plan works. If you have a Medicare Supplement and you go to the doctor, most of the money that the doctor receives is paid directly to them by Medicare. However, if you decide to enroll in a Medicare Advantage plan, the money comes from the same place, but it does not go directly to your doctor. If you were to enroll in a Medicare Advantage plan, Medicare has an agreement with an insurance company, and they transfer the responsibility of providing medical care to you to the insurance company. In this case, the insurance company is paid a monthly cost to provide medical care to you. They in turn find a group of doctors and specialists and hospitals to form a network. These doctors and hospitals, they have a contract with the insurance company that stipulates in advance how much money they are going to receive for their services whenever they provide medical care to you. You in turn also have an agreement with the insurance companies that stipulates if you go receive medical care, as long as you stay in network, you're going to have a schedule of cost-sharing payments that you are responsible for. Sometimes these are small amounts. For example, maybe $20 to see a doctor, $40 to see a specialist, and so forth. But every single thing that you do is going to have some type of a cost-sharing ingredient built in. Some of the pros of a Medicare Advantage plan are, usually when we compare the monthly premium we can offer you on a Medicare Supplement policy to the monthly premium that's available to you on a Medicare Advantage plan, the monthly premium on the Medicare Advantage plan usually is less. So this is an attractive feature in the sense that you have some savings every month in what you're paying in your monthly premium. Another pro to a Medicare Advantage plan is that your Medicare Advantage plan does include prescription drug coverage. If you have Medicare and a Medicare Supplement, you then have to have a separate Part D prescription drug plan that is also an additional monthly cost. Another pro to a Medicare Advantage plan is most of these plans will try to throw in a few extra benefits just to sort of make them feel more attractive. Some of these might include some dental coverage, some coverage for vision, some coverage for transportation, a discounted or free membership in a local health club, and so forth. So these are some of the reasons why a person might feel like choosing a Medicare Advantage plan is a good idea. Some of the cons, some of the reasons why you may not want to consider a Medicare Advantage plan is, number one, you do not necessarily have flexibility in choice of providers. If you have a Medicare Advantage plan that is an HMO, it's a very strict network. You can only go to doctors that are in the network. You have to go to your primary doctor first and get an agreement and permission to see a specialist. Then you have to receive a referral to a specialist that's in the network, and so forth. If you have a Medicare Advantage plan, which is a PPO, you're going to have more flexibility, but you certainly are not going to have nearly as many choices as you would if you had Medicare and a Medicare Supplement. The most important reason why you may not want to choose a Medicare Advantage plan is because most of them do have a rather large maximum annual out-of-pocket. Your maximum out-of-pocket is simply a number that if you have paid out a certain amount of money each year that you no longer have to pay. For example, if you encountered a little bit more medical bills in a year than normal, every time you leave the house for any type of doctor visit or treatment or therapy or emergency ambulance, home health care, and so forth, you have some cost-sharing ingredient. You pay out, and then you pay out, and then you pay out, and then eventually you're going to reach a certain number. Some of these plans have a $4,000 or a $5,000 or even a $6,000 per year maximum out-of-pocket. So even though you may be saving money each month in your monthly premium, when all of the numbers are added up at the end of the year, you actually may have cost you more money to be on a Medicare Advantage. So there's been a lot of interest lately, a lot more advertising. I've had many of my customers and many prospective customers calling me, asking me, Billy, should I get a Medicare Supplement or should I get a Medicare Advantage? My usual response is, if you can afford the monthly premium for a Medicare Supplement, that is a better option. You have more flexibility, you have more predictability. You're also going to have a much lower maximum out-of-pocket. I hope this information has been helpful. I know making this decision can be a bit confusing and stressful. If we can help you in any way, we certainly want to. If you would give me a call, we can look at where you live and your age and your medications, and we can even consider what doctors that you're going to. We can make a decision based on these factors, give you some idea what the monthly premium on a Medicare Supplement would be for you. We can also give you some idea in your area what the monthly premiums are on a Medicare Advantage, and let you compare the two to decide which would be the best for you in the near future. My services to you are always free. This is what I do for a living all day, every day is Medicare. I've been doing this for 10 years. I'm currently licensed in 35 states. I hope that the information in this video has been helpful. We look forward to speaking with you in the future. Hope you're having a great day. Thanks.